Morning everybody. Today as a group our topic is people with mental illness. So my sections will talk about introduction and background. So regarding the introduction, first of all, dealing with mental health issues and their treatment remaining a challenge for any society, community and country. Study of mental health literacy show a stigma related to mental disorder and poor recognition of mental disorder. It observed about 80% of young populations suffer from mental illnesses and don't get the mental health care they need. So what's mental illnesses? What's the definition of mental illnesses? Mental illnesses is a behavior and emotional disorder that lead to deficiency in a functioning in a social, work and family activity of an individual and limited major life activities of the patient. Now we'll talk about size and statistics in Australia. About 6% of Australians have mood disorder and about 14% have an anxiety disorder, 5% substance use disorder. 1 million of Australians suffered from affective disorder, and that's more likely female rather than male. 38% of people show comorbidities that are associated with a high risk of suicidal and great impairment. 65% of people with mental disorder don't get an access to the health services. Australian government spent almost $20 billion on a mental health care and expenses is increasing every year. So now we'll talk about history. In 1839, no medical diagnosis of any patients who were having mental illnesses, and in 1883, scientific management of the asylum under the medical control was made mandatory. In 1911, the first asylum was built for mental people in Australia. In 1992, the National Mental Health Strategies was developed by states and national with ministers. So why we choose this group? So why this group is vulnerable? Why they are at risk? Because this group, they have poor mental health literacy and also poor access to mental health services. Also, mental disorder bring other challenges like stigma, isolation, and discriminations.
Suffering from a mental illness face, but the focus of our presentation is going to be on funding and stigma. The 2017 federal budget allocated $115 million of the funding over a 4-year period to mental illness and mental health, which is one of the smallest investments over recent years. In 2014 to 2015, the overall burden of disease from mental illness was 12%. However, only 5.25% of the overall Australian health budget was dedicated to mental health. Additionally, data acquired from the Mental Illness Fellowship of Australia shows most countries that belong to the Organisation of Economic Cooperation and Development, including Austria, Belgium and the United States, spend between 12% and 16% of their health budget on mental health, while Australia in comparison only spends 8%. The World Economic Forum, with the assistance of a group of health economists, were asked to estimate the global costs and project costs to 2030. Their estimate, based on 2010 data, showed that mental disorders as the largest cost driver at $2.5 trillion in global costs in 2010, and projected costs at $6 trillion by 2030. The lack of money being dedicated to mental health both directly and indirectly affects those who suffer from a mental health condition. Patients are directly affected as there are a lack of resources for treatment, and what resources are available are too expensive for a vast majority of Australians to access. It also makes it more difficult for people living in a rural area to access specialist care, and it also means that there's less education in school systems to provide knowledge about mental illness and mental health. The low budget also means that there is less money dedicated to mental health research. Another issue is stigma. The World Health Organization defines stigma as a mark of shame, disgrace, or disapproval which results in an individual being rejected, discriminated against, and excluded from participating in a number of different areas in society. Scrambler describes stigma as any attribute, trait, or disorder that marks an individual as being unacceptably different from the normal people with whom he or she interacts and elicits some form of community sanction. It is estimated that 1 in 5 Australians suffer from or have presented symptoms of a mental illness. However, figures have shown that only 18 to 34% of young people who suffer from high levels of depression and anxiety actually seek help for the illness. This reluctance to seek help is not only limited to young people, with an estimated 35% of adults with a common mental health problem seeking help in the previous year. The amount or kind of stigma that is experienced is influenced by a number of factors, including age, gender, and the illness itself. The most common elements of stigma are the perception that the person is weak, that they are dangerous, or that they are able to control their illness, as well as reluctance to tell people their diagnosis because of shame, guilt, and embarrassment, and also a desire for social distance. Stigma can cause people to feel shame about their condition and therefore reduce the likelihood of them seeking help, as they do not want to admit that they have a mental health problem. Stigma and discrimination may also worsen their condition and increase recovery time. This not only affects the person who is suffering from the illness, but it affects their family, friends, and possible caregivers.
Mention in our solution for people with mental illness group. So due to the lack of fundraising nowadays, what we should do is promoting mental health funding, which can associate with the federal budgets to improve mental health service system, plus allow more mental health researches in the future. Secondly, we need to organize more mental health education in public schools, workplace, so people can gain more knowledge about the first signs of mental health, so they can help themselves and their loved ones have early intervention or know how to treat and communicate with people with mental illness appropriately, which help them feel free from stigma, violence, and running more activities in which people with mental illness can get involved and interact with other people, so they will feel more positive and reduce their feeling of discrimination, self-isolation, but gain more self-esteem and improve their health conditions. And we also encourage people with mental illness to gain education as other people and joining social activities, which will help them to develop and enhance their own capacity, so they can find their own interests and getting employed, so they can have their own economic resource. Regional, rural, and remote Australians face significant challenges due to such things like isolation, lack of service, and severe weather conditions impact their livelihood. So this can lead to suicide in rural area higher than major city, and people in rural area can easily get mental illness more than people in major city. So what we should do is improving access to mental health service in rural area, such as via phone call, video chats, or running more education sections in rural school and rural areas that promote social work, so people can recognize the first signs of mental health illness and where and how to seek for help. There is some sample of mental health promotion and resource nowadays, like Kids Matter is a mental health promotion. It gives prevention and early intervention and developed for primary school and early childhood education, and help children with mental health illness can fully develop and get involved at school. And My Ai Connect will provide more information, programs, and news about mental illness that people can get access to and support and find necessary resource. Mental health programs and policy can ensure that patients with mental health illness or people who are at risk and their family can access to quality services and information, and it can meet their needs for the healthcare practice. So health practitioners should practice under Mental Health Act 2014, so provide treatment and provide treatment in the least restrictive environment, so enable the care and treatment be effectively, and try to design the treatment appropriately as much as possible, and any restriction upon the liberty of patients and other persons who are mentally ill, and any interference with their rights, dignity and self-respect is kept to the minimum necessary in any circumstances. For nursing practice, we suggest for education, like developing nursing knowledge regarding to mental health from the beginning as a nursing student, and the hospital should provide supplementary clinical mental health education section to the nurses, especially in rural areas. Our level of skill and knowledge affect the willingness of nurses to provide the clinical care to patients with mental health illness, and have adequate skill and knowledge will help the nurse to build confidence and capacity to dealing with mental illness patients.